Welcome back to What's Now. Right now, we are going to talk about hemophilia. Individuals who struggle with this have to be concerned about even minor bumps and bruises. Well, there's a new approach to managing hemophilia. I spoke with a physician and a patient who struggles with this disease. Here's more.
People don't usually have to worry about minor bumps and bruises, but for those with a rare bleeding disorder, experiencing bruising or bleeding after something as routine as a minor fall can be alarming. In recent years, important treatment developments have brought hope to people living with hemophilia, and many may have a new outlook on living with a chronic condition this coming holiday season. Here to talk about an approach for managing this disorder are hematologist-oncologist Dr. Amy Shapiro, co-founder of the Indiana Hemophilia and Thrombosis Center, and Guy, who is living with hemophilia A. Thank you so much, Dr. Shapiro and Guy, for joining us today.
Thank you so much for having us.
Thanks.
Dr. Shapiro, what is hemophilia A and how many people does it affect?
Hemophilia A is a rare genetic disorder where the blood does not clot normally. People with hemophilia bleed longer and often into their joints and muscles. And if these bleeding episodes are not controlled, they can lead to chronic joint disease and chronic pain. Bleeding episodes can be life-threatening when they occur in vital organs. About 20,000 people are affected with hemophilia A in the United States. It is a rare disorder, and because it's rare, we still hear many misconceptions about the disorder and the people who live with it.
So, Guy, what has your life been like living with hemophilia A, and what challenges have you faced?
So I myself haven't known much since birth other than hemophilia. At ages 1.5 and 3, I had 2 strokes, which were spontaneous head bleeds contributed from hemophilia, and the residuals from that were I was left legally blind and I gained seizures from it. But I would go to the hospital 5 days a week to get treatments, and eventually home treatments became available. And even those were a struggle because I wasn't able to see the veins. So they implanted a device in me just like someone with cancer treatments would get. And even that, my experience personally wasn't the greatest. So when a new treatment came along, I was the first one to raise my hand and say, let's try it.
And Dr. Shapiro, what can you tell us about the change you've seen in this patient community thanks to advances in treatment for patients like Guy?
For people like Guy living with hemophilia A, until a few years ago, all FDA-approved preventative medications were administered into a vein, or what we call intravenously, as Guy described, up to a few times a week. Now people with hemophilia A have the option called Hemlibra, which is a prescription medication used to reduce or prevent the frequency of bleeding episodes. This is the first medication for hemophilia A that is administered as a shot under the skin, or what we call subcutaneously, like insulin. It can be given at home after either people with hemophilia or their caregivers are taught to administer it. Hemlibra, like all medications, can have side effects, some of which can be serious, like excessive clotting or thrombosis. And this is usually when Hemlibra is used in association with a specific medication. So it is important for people considering this option to speak to their prescribing physician.
And Guy, what led to your decision to try a new treatment?
Prior to starting treatment, I was treating almost every day of the week, and I had just started college. I started late going back to college, and I was in film school online, so I was carrying around huge cameras and equipment attempting to try to film things, and my joints weren't working, and trying to walk around. And when the treatment became available to me, I'm now bleed free, and again, my experience is different than someone else, but at the same time, I'm able to definitely talk to your doctor and see what plan is right for you. But I was able to start my own small business. I graduated from college twice because of switching meds, and I just got married this year too. So, and if it wasn't for switching meds, honestly.
Well, it's so good to hear that this has been so helpful and really changed your life. Dr. Shapiro, where can we get more information?
There is information available on the internet. There is a website called hemlibra.com, which you can go to find more information. And I do want to thank Genentech, who has partnered with both Guy and myself to bring more information about hemophilia A, this rare disease, into the community. Thank you.
Well, thank you so much, Dr. Shapiro and Guy, for joining us today here on Park City Television with this important information. And Guy, I really appreciate your honest story. I know it will help many people.
Thanks so much.
Thank you for having us.